Well, welcome to the 7 o'clock talk. I'm Dr. Miller and this is Nurse Jessica. And tonight we're going to talk about several different things. We're going to start off by talking about the farm bill that comes up for vote next year. And then we're also going to talk about the question of what's the difference between functional medicine and allopathic medicine. We had a question about it. And so I got 10 little things to go over on that. And that way people can see that they're different and they're meant to be complementary. But regardless, let's talk about the Farm Bill. Where'd that book go? Hope I'm sitting on it. So Dr. Hyman wrote a book called Food Fix. And this book, hi Kathy, this book covers how we can fix a lot of our problems in our healthcare system. We can fix a lot of the problems with the soil and the desertification of all of our farmland. And so if you care about food, if you care about the earth, I would highly recommend that you read this book and then get involved with talking to your state reps and the people in power. The food bill absolutely needs to go through because we need to help our farmers and we need to help those people who have food insecurity. Those things have to be done. But what doesn't have to be done is we don't have to subsidize big ag. We don't have to subsidize sugar because that's literally killing us. Of our functional medicine and chiropractic patients, what percentage would you say suffer from too high a sugar, too high a insulin, have inflammation from it?
Probably 80% or more.
And it's just getting worse. And so there are fabulous statistics in here. I have given this book to both my state reps and my congressman. I gave it to my priest at my local Catholic church, and he's going to go in and see the reps. I'm supposed to hopefully be joining them to go in and see and talk to the representatives. It's of the utmost importance. This isn't just for you, but it's for your grandchildren and your great grandchildren because that's how important it is. This bill comes up every 5 years, and just a couple things that would be great if we would stop subsidizing sugar and if we would start a soda tax. If you could start a soda tax, you could pay for a lot of programs to help those people who are food insecure.
Got a fur baby crying for me.
Yeah. So, anything else you want to add to that?
No,
So, if you have any questions, go ahead and type them in. I do have the iPad here and I can answer. But number one is functional medicine and allopathic medicine, also known as conventional and or Western medicine. They differ in several key aspects. And here are 10 differences between the two. Focus on underlying cause. So that is a big thing between the difference between allopathic and functional medicine is looking at the root cause, as we call it, and where functional medicine tends to look at how the systems are dysfunctioning, how they're not working the way that they were designed to work, and it starts to address those dysfunctions. Now, it takes time. You know, most people didn't get sick overnight, and you're not going to get out of it overnight. But it takes time to dig your way out of that hole or to fill that hole in, however you want to say it. And there is a big difference. The things that allopathic medicine concentrates on is it focuses on symptoms, symptom management, and disease diagnosis. And the big thing is if you have inflammation of the joint, it's called arthritis. And that's just a descriptor. It doesn't say how the inflammation got there. And there are three things that trigger inflammation: food, stress, and then, of course, inflammation. If you're injured, if you've hurt yourself in some way, then that starts to happen. What you are on the medical side. How does that whack-a-mole system, symptom whack-a-mole, how does that work? How's that end up playing out?
You don't really have them talking about inflammation. Most people are complaining of pain, and they don't know that it's. I don't. I. They really never talk about inflammation in the hospital. It's always about pain.
And so they give you a pain medicine, and
So
then
they give
what
you
does the
pain
pain medicine
medicine, or
do?
they'll give you an anti-inflammatory.
Well, let's just go through
Well, I
this.
mean, like what kind of pain medicine? There's all different kinds, but
Well,
narcotics is where they really end up, and then the narcotics create constipation, lethargy. It the tolerance goes up, so they need more, which can lead to addiction. Um, it's just kind of a vicious cycle.
one pill leads to two, leads to four.
And then I mean, they become depressed, and then they isolate themselves, and then they get an antidepressant, and it can upset their stomach. So then they probably have a PPI of some sort. It's bad. It's a vicious cycle. But I never really have anybody say, "Oh, I have inflammation." I mean, there are doctors that talk about the inflammation or erythema in your joints or something, but most of it's usually they just categorize it as pain. Most people do.
The second difference between the two is what we call a holistic approach. So, functional medicine takes a holistic approach, and it looks at the individual's entire being, or holome, as they say. So, this is what happened when you were a child. Were you a C section? Were you a vaginal birth? Were you fed sugar at an early age? Were you given wheat at an early age? Were you given milk at an early age? Starts to look at these things, because these are the decisions that were made, some of them by you, some of them by your parents, that got you to the point that you're at.
That's funny because rice cereal is usually the first thing given after milk, and they have found that that actually is a horrible thing to give a baby. They should actually give them their first food should be a vegetable
and
not a sweet one.
And not only that, when we're giving kids Cheerios have more glyphosate per serving than vitamin D. So you're giving your child an antibiotic when you are giving your child Cheerios, or baby, or whomever. And if you're eating Cheerios, just stop. If you're listening to this and you care about your health, just quit eating Cheerios and basically cereals in general. Anything that comes in that package, if you look at that package and there are more than 5 ingredients on the package and you don't know what they are, or you can't spell them, then you should not be eating those things.
And if you're eating Kellogg's products, go research that one.
Yeah, we've covered that before. So today I had a 19-year-old that I have known the family forever. I've known her since she was probably 2. And she comes in, and the rest of the family is pretty big. I look at her, and she is 104 pounds. She's 5'5" and 104 pounds, and I'm looking at her, and of course I'm in Jennings County. This is not a knock. This is just the reality that we're in. I start looking at the mouth. I start looking at the teeth. I start looking for signs of drug use, and it's not there. And she's like, I just can't gain weight. And so I was talking to her, and I said, okay, what's your breakfast? Oh, I get up, I eat real well. And we were having this discussion. Just because you're eating 3 meals a day, and she said she was eating 3 meals a day, does not mean they are healthy meals or good for you meals. She wakes up, she starts her day with some sort of juice, or maybe a soda and a Pop-Tart. Then her snack is a Lunchable, or what are those little peanut butter and jelly, a crustless Uncrustable or something she called it. And then at night she comes home and usually has fast food. And we are seeing kids come in sicker and sicker at a younger age. And this is something to think about. Up to age 25, you're an expression of your genetics. After age 25, you're an expression of what you've done to your genetics. So this young lady should still be blossoming, blooming, maturing, all of that jazz. And she's already showing signs of illness and chronic illness. I hurt all over. I don't have any energy. I'm amenorrheic. I have acne everywhere. And so I'm like, you're getting PCOS. She had a little acne on her face. But as people have heard on this channel over and over and over again, what you put in your mouth matters. 80% of your health is determined by what and how you eat. So we look at the entire lifestyle, environment, genetics, emotional well-being, and we look at personalized care, whereas allopathic medicine often treats just specific symptoms or diseases without necessarily considering the broader context of the individual. So basically, something has happened to you, it's not by any fault of your own, and you got pain. Here's your COX2 inhibitor, and just be aware we're going to be checking your heart because you have a COX2 constituent in the heart, and you might have heart trouble, or you might get heart damage. Or if you're taking anti-inflammatories, we got to check your gut because you may develop an ulcer. Or if you're taking aspirin, we got to check your liver. And so there's always a trade-off. When you go down a functional medicine route, we don't necessarily have to check those things because we don't impede, we try to help the body push through. Patient-centered care. This is Jessica's favorite part. She loves to sit down. Well, I love to sit down with the patients too. But sitting down with the patients and developing a plan with you because it's your care. You've heard me say multiple times, you drive the bus. You've heard Jessica talk about sitting down and talking with the patient. She'll sit down with patients and, like, if they're smokers, why are you smoking? There's a reason for this. What's the reason? And she starts to dig down into whatever the emotional reason is, or, what's the most common thing that you're...
It's their me time.
Yeah.
It quiets their brain. I'm so fascinated with our backyard. We have the most beautiful birds flying by here.
She's ADD.
Most of the time, it's
Squirrel.
my me time. It's their way of calming themselves.
And so functional medicine places strong emphasis on the patient-doctor relationship. It's a collaborative decision-making process, and patients are actively involved with their own healing process. The practitioner spends more time with the patients to understand their health stories and concerns, whereas allopathic medicine typically follows a more traditional doctor-patient hierarchy. And you've got to remember with that, there is a time for that. I'm not saying you should never see your medical doctor. Medical doctors save lives. That's not my bag. My bag is not life savings. If you're in trouble, she's going to look at me and say, they need to go to the hospital now. We're not lifesavers in the respect of bringing you back from the dead. We help you get more out of your life.
No, if we see something that's wrong that needs medical attention, we send them there first. They come back to us when they're better.
Yeah. Preventative focus. Functional medicine places emphasis on preventative care by optimizing overall health. It aims to identify and address imbalances before the disease state progresses. Allopathic medicine, meanwhile, recognizing the importance of prevention, often focuses more on the acute and chronic disease management. It's about that management. That's not actually the doctor's fault. That's the way their system is set up. I am conspiracy theorist. I believe that has been set up by the pharmaceutical companies because they like that residual income that you have to go every 30, 60, 90 days and get your scripts filled, and they just keep getting more and more expensive. But with our patients, what do? We educate them. We show them their triggers. We look at things, and that way, once you get to a certain stage of health, yes.
Well, I'm talking about triggers. Most people don't even know that their food is a trigger. until
Oh,
they've
yeah.
taken the food away, because most of them will sit down with me and we will talk in length over their elimination diet, which is what we use first off. And they're like, oh, I can eat everything and nothing bothers me. But then they quickly learn that things bother them about 2 weeks later when they start adding things back. And then we educate on these may be permanent triggers, but most of them aren't. You can usually work through it.
And the other thing that we've started to do is we do cooperative care with other practitioners. And we've been referring to Haley first, actually, before people even start with us,
Everybody needs Haley.
so that they can start to get those lifestyle issues under control. I mean, I like lifestyle stuff, but the only person's lifestyle that I can influence and affect is mine. We've tried to exercise together and we just don't jive on the same schedule. And that goes for patients as well. You were going to say something, I cut you off.
I was just going to plug Haley again. So Haley isn't like a health coach like most health coaches. Like, she really lays some really deep, like, root foundations. Like, she really gets to your why and what makes you tick and what's causing you issues, and teaches you how to deal with that before she ever talks about food. So she's really awesome. So I think if you're struggling and have the ability to have a health coach, Haley Hennessy is probably one of the best that for myself, have come across.
Yeah, I
She's
don't
really
use
different.
Haley. I haven't used Haley, let me put it that way. But I have done multiple rounds with health coaches and life coaches and all of those things. So I know what makes me tick. And that's one of the things you got to figure out. Jessica, for the longest time, made fun of me for having health coaches and life coaches. Integrative treatment options. Functional medicine incorporates a wide range of therapeutic approaches, including nutrition, lifestyle modification, herbal medicine, stress reduction techniques, and other complementary and alternative therapies. Allopathic medicine primarily relies on pharmaceuticals, surgeries, medical interventions, and treatment modalities. And just like we were talking about integrated medicine, we will work with your medical doctor and work with the medications that you're already on. We don't adjust medications. We're not licensed to do that, but we know what they do. We look them up. We look up the nutritional deficiencies that they do in you. We help support those processes.
Well, and then we monitor. So we will monitor blood sugar and blood pressure. And when we think you're getting close to needing medicine adjusted, we send you back to your primary care. We don't take care of that, but we do follow it very closely.
Well, and on the flip side of that, here's another announcement that we have going on. It looks like we're going to have a nurse practitioner coming in, and she can do the pellets in-house.
She does the hormone replacement pellets. She can do Botox injections, and she is going to do like the peptides. And then she has the ability to use a laser in a different facility.
And we're also looking at bringing in somebody for wound care. So if you know somebody that wants or has a wound that won't heal and they've already had it treated, we will have this one's still up in the air, but I am excited about it because we have diabetic people.
That's fascinating. I love wounds. I love wound care. So I'm super excited about that one. And that is a new program using amniotic membranes from fetus, from scheduled C-sections, where that tissue is donated.
And then the other thing is also the nurse practitioner will be bringing in the integrated solutions of, we'll have somebody who is seasoned in using peptides to help our patients as well.
I was going to say, she also is holistic minded.
Yes,
yeah,
she works well with us. And so that's the integrated treatment approach. whereas allopathic medicine relies mostly on pharmaceutical surgeries and medical interventions as treatment modalities. They're going to tell you maybe need hormones, but do they have it in house? Do they have to refer you to 1,000 places? Don't know. We just want to kind of have that all in house. Ultimately, I see having a regenerative medicine practice where we will have people doing ozone therapy, prolotherapy, and all of that. But that's a ways down the road. That's the dream.
But we're dipping our toes in it.
Yep, we are. My favorite is use of laboratory testing. Functional medicine utilizes extensive laboratory testing to evaluate various biomarkers, assess nutrient deficiencies, hormone imbalances, genetic factors, and other functional markers of health. Allopathic medicine primarily relies on standardized lab testings, blood testing, for diagnosis and monitoring, and often focusing on specific disease markers. So, all of our tests look at how your body is functioning. A lot of the allopathic medicine doesn't look at how the body's functioning, it looks at the markers of what has happened. And that's the difference. And we look at the microbiome. A lot of medical doctors I talk to don't even really believe in the microbiome at this point.
The microbiome is exploding. It's like it's really big. Lots of people are now really paying attention to their own microbiome.
Well, one of the MDs that I love, which is Dr. Peter Attia, the man has an incredible mind, but he's like, I don't have the research. I don't, until they can show me the microbiome does X, Y, Z, and there are these big studies. He goes, the microbiome is nothing to me. And I'm like, okay, I'm sure those studies are all coming, because papers on the microbiome and how it affects every facet of the human body are coming out daily.
And we have the ability to do all those tests in-house.
Yeah.
So we can do all of those health-related, microbiome-related, wellness.
Well, those are just foundational tests for us.
Yeah, for us, they're the foundational tests for our functional medicine patients. But we have the ability to do all of those lab tests for anybody in-house.
And we're actually the only ones that I know of that are even doing telomere testing around here.
Yeah, that was really fascinating.
So, time-intensive consultations. Yeah, they are. You can guarantee we're going to sit down for an hour.
Well, it's never an hour. It's more like 3.
The first exam, the initial exam, the report of findings, you're looking at 3 to 5 hours. We're going to be there, and it is, honestly, it's awesome. It's a lot of fun. You really get to know the patients. What makes them tick. You get to know family members. It's amazing, and it's a lot of fun.
Yeah, it's very emotional.
Yeah, we often have people crying.
Well, I think almost 90+% of ours cry, male and female. It's very powerful to put up a timeline and to see life events and triggers, and they know exactly where.
And we refer out to therapists, because there's sometimes emotional trauma that has been unresolved, and we know our limits.
But we know the people that can help them.
Yeah. So let's see what they say. Time-intensive consultations. Functional medicine consultations tend to be longer, allowing practitioners to delve into the patient's history, conduct detailed evaluations, establish personalized treatment plans. Allopathic medicine consultations are often shorter and focused on specific symptoms or concerns. Emphasis on lifestyle modifications. Absolutely. This is a big one for us, because we look at the 5 pillars to health: sleep, nutrition, exercise, stress, and community. Those things, if you get those 5 things on point, there really isn't much else that can really put the hurt to you.
It's sprinkling me with love over here.
And so, once again, that's when you're talking about nutrition and sleep and all that, that's 80 to 90% of what functional medicine takes care of. And then when we've got people that are coming in that are older, sometimes we have to start to try to reverse damage that's been done. And it can take a while, but it absolutely can be reversed. It just takes time.
And it's so beautiful to watch them blossom.
Mm-hmm. 9, individual treatment plans. Those are fun to make up because I sit down, I talk to the patients, we go through like, here's the gold plan. These are all the supplements you're eventually going to be taking. Do you want to load them up now? Do you want to wait? Do you want to extend things? We have some patients who are just like, I want to get it done. Let's have at it. And then I have some patients who are like, well, I need to be a little more sensitive and I want to draw this out a little bit longer. And so it just takes more time. Then you get your little handy dandy sheet of paper, and this is when you take this, and this is how you take it, and off we go. Jessica walks you through the elimination diet.
Yeah,
Yeah.
and a lot of times I'll hold your hand and figure out something that you can have, because I would never want somebody to throw the whole diet away over one little thing they can't eat. So we figure out the best case scenario and work through it.
And we're invested in our patients because we had one this past weekend who's having allergic reactions to monk fruit of all things. And, we worry. We just keep in contact.
Yeah.
Because
they got my cell phone number and they message me, and we keep in tab with them.
So, individuals, functional medicine develops a personalized treatment plan based on the unique needs of each patient. It takes into account their genetic makeup, environmental exposure, personal health goals. Allopathic medicine typically follows more standardized treatment protocols based on evidence-based guidelines. And I would say that's possibly a little questionable. I would say, show me the evidence and show me the study for the evidence, because if it's a industry sponsored, I'm not going to believe it. If it's something done by a third party, okay, I'm more likely to believe it. Philosophical differences. Functional medicine challenges the reductionistic approach of treating symptoms in isolation and emphasizes the interconnectedness of the body systems. So in English, what that means is we had another functional medicine patient today come in, and he's a 60-year-old male. He is a hard worker, and this man pushes himself to the nines. And so he's like, my hands are weak. I'm losing my strength. This weekend, I couldn't open up a soda bottle. He goes, what is wrong with me? And we had his blood work, and his blood work, nothing was super bad until we got to his insulin. Fasting insulin should be between 3 and 4. His was a 53. This is well over the diabetic range. And I'm like, well, let me explain to you how this happens. Insulin is a pro-inflammatory hormone. It is also an anabolic hormone. So if you have a ton of insulin flowing through your system, it is making bone spurs grow. It's making anything inflammatory grow. And it causes skin issues. It causes all kinds of stuff. And it's all interconnected. He was having gut problems. Well, when your blood sugar stays high, your adrenal glands sense that you're under stress. So it starts to shut the body down. It starts to throw out reverse T3. It slows the thyroid down. He was starting to gain weight and he couldn't get rid of it. And so there are all these things that point to this insulin resistance that he already has. Now, remember, there really wasn't a whole lot of other stuff that was wrong, but there's an adage in triathlons that you cannot outrun a crappy diet. And this man drinks multiple Mountain Dews a day. He goes, but I work hard and I eat well. And I go, I get it. I would love to say that that was enough, but you can't out exercise a crappy diet, and you're paying the price for it. And your insulin levels show this. That is a root cause. High insulin is a root cause. And so I was like, that'll make your arthritis worse. That'll make that inflammation worse. Every type of chronic disease is associated with insulin resistance. It's a bad player, but it's a player that we need. So let's see. It draws inspiration from ancient healing traditions and seeks to integrate the best of conventional medicine with evidence-based alternatives. Allopathic medicine is rooted in the method of following a reductionist approach, focusing on specialized treatments for disease-specific protocols. It's almost like they missed the forest for the trees, because they get to where they're so keyed in on one thing that they don't really look at the rest of it. Now, there are some good doctors out there that do, but a lot of times they just want to see that, and they want the pill that goes to that. Or, as we've come to find out, basically you start typing in the symptoms and the protocol gets spit out on the computer. They don't even have to critically think about it anymore. No. So we both have our place. If you are dying, medical doctor, hospital, hands down. We are tops in the world for that. But once you get to where you're stable, we drop out of the top 20 and we're like 23rd or 4th in the world at getting health back. So, anything you want to end with?
Get yourself a pet. Go to the animal shelter and rescue one.
So, just a brief recap. Let's talk about, the farm bill. Hey, get a hold of those guys. If you have any questions about these things, ask away. Next week, we will be talking about why somebody would seek out a functional medicine practitioner. What are the symptoms and what are the things that are going on that you would see a functional medicine practitioner for? And that'll help you start to make the decision, because functional medicine is something that everybody should do, because it helps you figure out how your body ticks, and then it helps start to figure out ways to bring it back.
Optimize it.
Yep. You can't beat Father Time, but you can play nicely with him. Have a great evening.